So let's shift to the next editorial. It can be covered under GS paper 2. So we know the importance of blood in our existence. It transports oxygen to our body. It also transports the food materials via the blood, okay, to the body, and the body get energized and many more things. But whenever there is a blood shortage to the body, we want blood source, and blood source can be via blood donation. But when it comes to the blood donation, there are various challenges. Okay, despite there is the availability of blood, but the hospitals, various country are not able to assess that. So here in this article, we will be discussing the blood management system and how it needs to be rejuvenated, re-evaluated. Okay, so when we talk about some scenario, do you remember the phase of COVID-19? I hope no one will forget this. Okay, so it exposed global public health inequality. How? Because various countries, specifically the poorer nation, they were facing the shortage of blood. And not only the shortage, there was lack of accessibility of the blood. Despite the blood was available in different country, but it was not being accessible to these nations. So that also reflected that the public health inequalities are there based on the country, based on the location, based on the state, let's say in case of India as well. Okay. So we need to have a resilient health architecture, and it is very, very important for the economic growth as well as the planetary health. And there can be the key strategy for this, like health financing should be there, digital health adoption, and apart from that, access to medical countermeasures. But here it comes a very, very important part, that is blood accessibility. We need to prioritize the accessibility of the blood, because let's say if there is any sort of blood crisis, okay, in the patient, in the hospital, so their life becomes very risky, and to protect that, there is a need to have blood availability. Okay, and you are well aware about various incidents of accidents, death, and there is damage of the body and many more things which requires the blood supply, which requires the blood availability. Okay, so it is irrepressible for upholding the patient health across various healthcare needs. And we have the global disparities in blood collection. It can be highlighted from the WHO World Health Organization report that the African region collects only just 5% of the global donations, despite this region consists of 14% of the population. So 14% of the population, but just 5% of the blood donation, which highlights the global disparity. And it is not only in the case of this African country, this pattern gets reflected in low and lower middle income country as well. And with respect to India, there is other scenario. Like in 2019-20, we have collected about 1.27 crore blood units, but still we have faced the shortage of 6 lakh blood units. Okay, so in India we do have the shortage of bloods. Okay, but when we talk about the importance of it, that is very, very important for the critical health services. Let's say people is facing the blood shortage, we need to provide them the blood. And for the accident victims, the heart surgery, bone marrow transplant, this requires lots of blood, and there is a loss of blood here as well. So to supplement, we need to have a blood, but it depends on the availability of blood in the hospital. Whenever you will be searching for the blood availability in the online portal, you will not find the desired blood. Okay, because it gets empty. So that is one thing, and it also leads to corruption, black marketing, and many more things. So there is a suggestion here how we can improve the accessibility. The first is your hub and spoke model. We know that in India there is various states, and in various states there is blood campaigns, blood donation campaigns, blood collection campaigns. Okay, so some state may do have the accessibility or the higher availability of the blood than the required, and some have the less availability but the requirement is more. So what we can do here under the hub and spoke model, there will be the centralized system that we will call as hub. Okay, and then there will be the small blood centers in different regions in the location that will call as the spoke. Okay, so let's say whenever there is the lack of blood availability in blood center A, so from this hub it can be transported or delivered to the A, and suppose there is a lack of availability in B, it can be transported to B, then C, then D. So this will be like hub and spoke model, so that the need should be fulfilled and there should be accessibility at all. Okay, and apart from that there should be robust public private partnership which can also address the inequities, and there will be lots of benefits like addressing the gap in terms of availability and distribution. Also it optimizes utilization. More utilization will be done by the small centers because we are supplying the blood based on the needs. Okay, and also it will reduce the expiration loss because many times blood is there, but because of that they are not reachable to different region or the location, they get expired because blood have the limited time for their quality. Okay, so this spoke and hub model will improve the accessibility in community health centers as well as the remote area. Okay, and we have the example like India's data showcase over 30 lakh blood units are related products discarded in 3 years due to the expiration, degradation, and infections. And here we are lacking just 6 lakh blood units, but here within the 3 years we are having 30 lakh blood unit got expired. So that means we have to ensure that these bloods should not get wasted. These bloods should get utilized to the needed state or the region. Okay, so that is the significance of hub and spoke model, and for that there is a need to have a greater collaboration and integration. Okay, and there are certain myths around blood donation, like people feel shy or they do not want to have a blood donation because they think that if they will donate there can be the fear of infection, there can be the immunity damage, and even that who will waste the time in the blood donation. So these are myths. Okay, and there should be the targeted awareness initiatives which can dispel, which can counter these myths, like grassroots campaigns should be there by the private sector, even by the government, in the social media, in the various platform, in the district, in the block, many more things. Okay, and here the best way will be like utilizing the social media as well as innovative tools. Okay, so we need to foster a culture of informed and voluntary blood donation, and hence we need to have a prioritization and accessibility to blood, which is a very important thing for a resilient global health architecture that will definitely save the life and the health and the need of the people as well. So hope you understood. And now we have the last question for you that deals with the antimicrobial resistance. Pause the video, try to solve it, and try to answer it in the chat box. So thank you, friends. Thank you very much for the session. Hope you enjoyed, and we will meet again for the next set of session. Thank you.